At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Causes and Treatment for Low Back and Leg Pain on Wednesday, February 18th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Hey everybody, welcome to Dr. Tom Roselle Live, Ageless Health, as we like to call it, right here on WMAL 105.9 FM in the Washington metropolitan area. Listen, got a great program for you today. And I want to say thank you to those of you who attended our in-house continuing education program this last Wednesday evening. It was a pleasure meeting you. It's the first one that I've done personally in a long, long time, because normally, as you know, I'm on the road teaching to docs and ongoing process, but it was fun. I really enjoyed it. And we got into some intimacies of, how the body really can soar, but also how it breaks down and things that you need to do and shift and change and so forth. It was fun. Thanks for joining me. And we're going to give you even a better application today. What we're going to talk about is hidden causes of low back pain. Did I say hidden causes? Yeah. Low back pain is the number one economic drain on your pocketbook and your employer's pocketbook and the world generally. And we're sitting up there at the top of the feed chain when it comes to this. Did you know that about 80% of you will have low back pain at one point or another? That's significant. Not just your low back is stiff, but pain. And so why is it such a problem? Well, we're going to talk about some of the hidden reasons why low back shows up. And I think you're going to be surprised with the things I'm going to tell you about. But remember, we're always here to answer questions. You can go to drtomroselle.com, or even better yet, go to rosellecare.com. Oh, by the way, before I forget about it, I want to let you know that if you go to our iStores or our Ageless Health stores on either drtomroselle.com, rosellecare.com, or getting into some of our supportive companies, we've started to put together things that you can, if you will, purchase, buy, that I think that you're going to be really, really pleased that the opportunity is there for you. So go to our iStores at Dr. Tom Roselle, or go to, the other platforms at Roselle Care and so forth, and, have some fun. Let me know what you think about, and then we can move on from there. All right, let's get into the program. Let's talk about those hidden causes of low back pain and the things that you need to be aware of. So what are we talking about? We're talking about things that you don't know about. So how many of you have gone to the dentist? Raise your hands, right? I'm raising my hand. And how many of you have had crowns put in or fillings put in, or, the dentist puts that little bit of that carbon paper, goes tap, tap, taps, move your jaw back and forth. And then he goes zip, 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 and they kind of file things down a little bit. Why is that a problem? Well, it can affect something called your temporal mandibular joint, or your TMJ. So that's right at the side. What's that got to do with low back pain? So that TMJ has a profound effect on multiple systems within the body, but more importantly, mechanically, it has an effect on your sacroiliac joint. Everybody's heard the sacroiliac joint, my sacroiliac's out. Well, if that TMJ is not positioned properly, then your sacroiliac is going to be unstable, and all you have to do is step wrong, bend over wrong, twist wrong, and now you got pain and sciatica, leg pain, that goes all the way down and starts biting you. So what's the person to do? Well, number one, think about it this way. When it comes to that, I want you to be aware of how the body is mechanically aligned. So when we look at a patient and patient comes in with low back pain, we want to know why it's there. If it's not identifiable relative to, I lifted like a 40-pound weight and I did it from, I wasn't warm. I just bent over. I just picked it up. I did that. I twisted. I turned. If it's not something like that, then it has to be something else. In this particular case, the temporomandibular joint is something that we look at all the time. How many of you chew gum on an ongoing basis? And you chew gum on one side or one side only, right? How many of you sit there and, you grind your teeth at nighttime? How many of you, have had dental patterns that we just talked about initially done where they put a plug in, meaning what? A cap, a crown, an implant, something of that nature. But now your bite's off. And how do they do it? I started talking about that little carbon paper. You're lying backwards and they put it in your mouth and they go tap, 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 grind back and forth. And then they go zip, zip, zip. And guess what happens? It's not lining up properly as it should. Why is that? Why doesn't it line up properly? Because when you lie backwards and they put that carbon paper, your jaw drops back. And you are not a back sleeping person on a day-to-day basis. You stand up. You walk upright. You sit upright, or at least you should. And when that happens, that mechanical distortion of lying back is not a true representation of what happens. Now, why is that important? As I said to begin with, the temporomandibular joint, your TMJ, works in synchrony in mirroring the sacroiliac joint. So if the TMJ is off, so is the sacroiliac joint. Now, on February the 18th, Dr. Harlan Browning and I are going to start going back and forth. We're going to pinpoint. We're going to show you. We're going to tell you how that low back problem can be, 1, prevented, 2, eliminated quickly, 3, get you off the crazy drugs that you're on, right? Here's the normal medical procedure. My back hurts, doc. Okay, take this. Let's see what happens. Take a couple Advil, take a muscle relaxer, take an anti-inflammatory, do those things. Well, we're going to send you for some stretching at the local physical therapy office. Physical therapists are not bad guys, but they don't understand the intimacy of what we're talking about. So when we look at that temporomandibular joint, we have to fix 2 things. We have to fix the TMJ and we have to fix the low back. Fortunately, most temporomandibular joint problems are a result of clenching too hard or chewing gum on an ongoing basis, because you're only going to chew on one side, and that side inevitably is going to produce the pain on the same side that you shove the gum over to. Now, look, all this stuff that I'm talking about is remediable. You don't even realize that you're doing it. How about you crunch on ice and just crack and chew and so forth? Or you put a pencil in your mouth or a pen in your mouth and you chew on that all day long. There's a lot of you to do that. You can say, yeah, I do that. But guess what you're doing? You're causing a potential problem on a lot of different areas. It could also affect your head and neck, but we're talking about low back here. What's another potential problem of hidden low back problems? It's called you're sitting all the time. Listen, when you're sitting and you're on your computer, you're on your cell phone, you're causing problems on multiple systems. Your neck and shoulders, obviously. There's something called tech neck, but also you're bent over. Your body's in a kind of a forward bent slump position. That's called a fetal position that you shouldn't be in. You should be up and moving around and stretching and so forth. So if you're in that desk position, that seated position, and you never do anything to do that, you get up to go to the bathroom, grab a cup of coffee, you come back and you sit again, that's not okay. You're jamming everything up. So think about it. We're talking about hidden causes, things that you can prevent. How about that extra 40, 50 pounds, 30 pounds that you're carrying around the midsection, and there's no tone to it? There's nothing to hold it in position. As long as that thing is there, you're going to have a potential problem of rupturing disc, of spinal degeneration, spinal stenosis, inflammatory reactions, muscles that are in balance, other muscles that are in spasm. So wouldn't it be a good idea to figure out how you could eliminate that? How about doing something simple? Get your butt up and go for a walk every day. Yeah, I said get up and go for a walk. So how many of you have really got into a pattern where you just get up and go for a walk? 10 minutes out, 10 minutes back, 15 minutes out, 15 minutes back, 20 minutes out, 20 minutes back. Do it slowly. Maybe you can only go 5 minutes, 5 minutes out. Next time you go 6 minutes out. Then a week later, you go 7 minutes out. And you work your way up slowly. Here's another one. Did you know your spinal disc, particularly your low back, need it more than any place else? Well, they all need it equally. The disc space, that sponge, if you will, it's not really a sponge, it's really pretty hard. The inside of it's like toothpaste. That's the center portion of the disc. That's the one that slips out, that leaks out, that causes the compression on the cords and so forth. So did you know that disc is 75% water? How many of you drink water on a day-to-day basis? More than just brushing your teeth, washing your face, spitting it out, and doing something like that. You need to get an ounce of water for every 2 pounds of body weight. And at least, shoot for, 80 to 100% of that. 80%, let's make this up. You're a 160-pound person, and that's 80, right? So we want to at least get 80% of that minimally. And that's what? That's 64 ounces. That's about 2 liters, pretty close. 2 quarts almost. So if you're a 160-pound person, how do you get it done? How about drinking a cup of water every hour? Don't just chug it down. You're going to trigger the urinary flow. Drink slowly. Guess what else you could do? You could put a little salt in it. You say salt? What? Table salt? No, I'm not talking about table salt. Table salt has all kinds of problems. Going to increase your blood pressure. Going to do dumb stuff like that. I'm talking about things like Baja salt, pink salt, Celtic salt. They have huge levels of mineralization. And you say, what? I can actually do that? Yeah, you should, because it'll make you feel better, much, much better. And how much do you want to put in there? Something like a neighborhood of a third of a teaspoon a day. You say, a third of a teaspoon? Yeah, sprinkle it here, put a little bit of your water, put it on your vegetables. Don't cook with it, put it there. Why is that important? Because it balances all the mineralization that most of you are so deficient in. So another hidden cause is that you're dehydrated and those disc spaces are getting beat up and the swelling, the inflammatory level goes through the ceiling. So if you did something like that, you drank more water, you went for a walk, and you stopped shoving your face full of ho-hos and sweets and sugars and things of that nature, maybe, just maybe, you might be able to resolve a low back problem that's going to cost you thousands and thousands of dollars over a period of time outside your insurance company. Why? Because at some point they're going to say, no, we're not paying for this. This is a chronic condition. We don't do that anymore. But what happens if you go into surgery? And we're talking hundreds of thousands of dollars. How about if you go in just for a Depo-Medrol injection? What's that? That's where they inject a steroid into the spine, into the disc level, into the facets, the gliding points. And they only can do 3 of them. Because why? It's a steroid. What's that have to do with anything? It has to do with the fact that it'll cause further degenerative changes in your low back over time and make things far worse than what you thought. So we've already given you a whole bunch of things to think about. Water, go for a little walk, lay off the sugars, the sugar, sodas, coffee, black teas, fast food, fried foods, garbage. How about just getting rid of the coffee? And all the caffeine that you're shoving in your system. Certain amounts of caffeine, there's arguments out there that it's good for you, but the acid that's within many of those substances, particularly coffee, will break your body down and destroy the soft tissue that makes up what? Your low back. So think about it. How many of these bad habits do you have? The sugars, the sodas, the coffee, the black teas, the fast food, the fried foods, the food additives, the gluten substances, the GMO manipulation of our food sources. It's an ongoing process. The toxins that we put in our system, they cause ligamentous swelling. Let me give you another one. Did you know that any joint in the body heals with high levels of what? Of sulfate ion. That's what gets into the tissue, causes the cartilage to repair, regenerate. You have that in your discs. You have cartilaginous substances. But you've been using NSAIDs, non-steroidal anti-inflammatories, to keep the pain under control. non-steroidal anti-inflammatories, Advil, Tylenol, Excedrin, whatever, you name your poison. So what does that do? That competes with the receptors, the targets, the lock and key where the sulfate ion should be going into. So it gets there first. So it drops the inflammation, but it perpetuates the degeneration because now you don't have the substance called sulfate to be able to repair it. So what's somebody supposed to do? Well, if you're hurting, why don't you try a natural anti-inflammatory like what? Like quercetin, high levels of it. What do I talk about quercetin? What's high levels? We're talking about 4,000 milligrams a day. It's not going to hurt you, but it can make a huge difference. And by the way, if you go to drtomroselle.com or if you go to rosellecare.com, ROSELLECARE.com, go to our iStore, and you're going to find that we've added something new that you can actually go in and buy product. Some of the things that we recommend. You'll go in, you click it on, it'll be there. And by the way, by the time you hear this message, you're going to be able to purchase a wellness package. And that, what I mean by that are things that we recommend to keep you nice and strong. One of them will help you back too. It's called vitamin D because most of you are highly, highly deficient in vitamin D. And the other is zinc that also helps repair tissue. So those are going to be available to you. You go on and get it. Go to drtomroselle.com. But better yet, go to rosellecare.com, 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 and check it out. And, can't hurt. Just take them. They're important and they will help you back. The magnesium level, the vitamin D level, things of that nature. It will make a difference. I promise you. And you add that to dehydration, you're good to go. You're going to be surprised how much better your whole body's going to feel. So listen, you can control this low back pain. If you're in back pain, here's what takes place. You can't do what you want to do. You can't participate in family events. You can't bend over and pick up your grandchildren or your children or playfully play with your spouse or your significant other. Why? Because you hurt. So you start shutting down. So wouldn't it be great to be able to do some things on purpose to resolve that, to get rid of it? I don't know about you, but I'm trying to figure out how I can get stronger and better and stronger. How many of you do any kind of exercise, whether it's, just twisting and bending and lifting light things like what, 1 pound, 2 pound, just to get a good stretch in on an ongoing basis? How many of you use your environment, your house, your office as a gymnasium? You go over to the wall, put your hands on the wall, push against the wall, like standing push-ups. How many of you do that? How many of you, playfully do a little dance movement and move your hips around, almost like a hula dance? Those are little things. They're silly, right? But they're things that will help you on an ongoing basis. So what are we talking about? We're talking about water. We're talking about taking right minerals. We're talking about quit shoving your face full of all the sugars and sodas and garbage that you do on a regular basis because they're making you, they're destroying your health, my friends. They're destroying your health. There's so much that we can do ongoingly. We started out talking about the temporomandibular joint. Don't let your dentist put anything in your mouth that wasn't measured from at least a seated position. Dentists hate me when I talk about this, but the guys that are really experts in neuromuscular dentistry, they get it. They understand it. They really get this whole positioning thing. Most dentists measure the teeth, or they do the vertical dimension of the teeth first before they look at the temporomandibular joint. It should be the other way around. You measure the TMJ first and then approximate the denticula, or the vertical dimension of your teeth, one or the other. And dentists are going to fight with me. I get them to call me all the time and they say, hey, why are you saying this? Look, here's the deal. There's people that practice neuromuscular dentistry the right way. And when you find somebody who really gets the mechanics, they're doing things very differently. They're going to find out really how the mouth should sit in normal approximation to each other. Why? because it's critical for so many other different functions. I'm going to give you another piece of the puzzle. Did you know that every tooth in your mouth has a spinal level and an organ system that it's involved in? Every tooth. So if you know that you're missing a tooth, if you know that you have a bridge that was put in improperly, if you know that you have a implant that doesn't hit seemingly the right way, I promise you it's affecting other places in your body as well. So you have to check those out. Go onto the web, go into Google search and go to neurological tooth, organ tooth relationship, spinal tooth relationship. And you're going to get all kinds of things that have come up. And then go to the images, and there's some great things out there, and pop them up. You do that, you read some of the literature out there, you're going to know more than your dentist does. Educate them. Do it nicely. Don't go in and hard bang them. Just say, hey, doc, did you know, what do you know about this neurological tooth thing? What do you know about, how the teeth and spinal system works together? If your spinal system is not lined up properly for many different reasons, then you're going to have an ongoing negative facilitation that's going to cause structural stress to the low back. How about your feet? Kids are coming in and adults are coming in wearing Converse tennis shoes. Converse were the worst of the worst back in the day. Now they're a status symbol. What's that all about? There's no arch support. There's no support going up into the ankle whatsoever. They're flimsy. They never were, in my opinion, any good relative to the support mechanism. My opinion, my clinical observation. I get to have an opinion. But they're going back to time when God knows why and how marketing positions these things. But here's the deal. Don't wear them. Ladies, if you're in spikes, when I'm talking about 3 and 4 inch heels, you're jamming your pelvic structure. You're forcing yourself over. Your body's not going to stay in that position. So you're going to try to stand erect. And when you do that, the gliding points of your low back, called your facets, are going to get irritated. They're going to get swollen. They're going to get really in a bad place. So if that's the case, better help yourself. You better get down off of those things. You better start wearing supportive shoes. I don't know about you, but, I spend a lot of money on my shoes and make sure that I'm balanced. I'm on my feet all day long, walking around the office, seeing patients. So join us on February 18th, and we're at the end of the program. I got a lot more coming from you. Remember, I'm here every Sunday for one reason only. I love you all. You deserve the information. See you next week. Bye.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Causes and Treatment for Low Back and Leg Pain on Wednesday, February 18th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
There's two kinds of love in this world. There's the kind you want and the kind you need. But everybody has the capacity to be kinder to one another. You should feel like heaven to make another's day. You should feel like heaven to live a better way. It feels like heaven to be alive, to be alive. It feels like heaven tonight. There's always a certain danger in learning to love a stranger. But faith teaches every man to strive for the best you can. You should feel like heaven to make another's day. You should feel like heaven to live a better way. It feels like heaven to be alive, to be alive. It feels like heaven tonight. If you don't know anymore to believe, and you can't count anymore all the times you've been deceived, if you're searching for something to call your own, but nothing comes to mind, and no place feels like home, you've got to see it for yourself. Take some time to understand. You're only gonna make it if you take another's hand. When you see a child smile, or read a letter that sheds a tear, that's what you remember, and that's why you are here, 'cause you are loved. You should feel like heaven to make another's day. You should feel like heaven to live a better way. It feels like heaven to be alive, to be alive. It feels like heaven